Okay, lately I've been getting a lot of questions from people who have had, say, a hip replacement or a knee replacement, and they still have a lot of hip pain or knee pain, even after they've gone through rehab and so forth. And so they're kind of trying to figure out, what's going on here. So today I'm going to talk about potential problems that continue to deliver stress to the hip or knee even after they're replaced. So it's important to understand that the problems that created the necessity for the hip or knee replacement need to be addressed as well as getting the joint replaced. If I have a significant problem with my left leg that has caused a breakdown in my left hip, and now I've just had a left hip replacement to fix the hip, if I don't address the problems that had led to that original hip replacement, then my hip replacement is likely going to experience pain. This is something that is missed by most people. They go to rehab after their replacements and they'll restore length and range of motion for the most part in the knee or the hip, but their pain doesn't go away. Well, most physical therapists' focus is to regain strength and range of motion and teach you how to walk again with your replacement. A lot of times they're not thinking about, well, why did you have that hip in the first place or knee replacement in the first place? And so that's what my books and home programs go into. In the case of a hip replacement, one of the primary problems that is occurring that is causing the hip to need to be replaced is that the gluteal muscles have shut down on the side of the hip replacement. Now, they could be shutting down from pain in the hip, or the shutdown could have preceded the pain in the hip, because the gluteal muscles are really important for causing that hip joint to work well. And if they are shut down, and then eventually, due to that lack of hip joint control, that breaks down the hip. Well, you get the hip replaced, but you haven't addressed how the gluteals function, then you're going to run into the same problems that were there prior to the hip surgery. So this is one of the big reasons why a lot of people have pain after a joint replacement, is because it requires an understanding of the body from a systems point of view. And by that, what I mean is that let's say your hip has been replaced. If you have a problem in the foot or the knee that has caused, say, that those gluteal muscles to shut down in the hip that then affect the control of the hip joint, and you have your hip replaced, but you don't address the foot or the knee issue that caused the gluteals to turn off in the first place, well, then you're just going to be facing the same problem again. You'll have a hip joint that is not well controlled. Another thing that is going on with hip or knee replacements is that a lot of therapists don't understand the idea of more anteversion or retroversion, and I address that here in this video where you can test yourself, and then I made a couple of follow-up videos of what to do if you have more anteversion or retroversion to help you out. So these kinds of ideas are not typically addressed in rehab prior to surgery or after surgery. Again, because physical therapists are mostly concerned with restoring joint range of motion, strength, and getting you to walk again. The same goes for knee replacements. So a lot of people like to blame their surgeon that there must be something wrong with the surgery, but the surgery is pretty standard. I mean, the cartilage is broken down, they're going to replace the hip joint and put in a new one, and usually, in most cases, that surgery is perfect. What isn't perfect is the control of your body that led up to the surgery and that's occurring after the surgery. This is why a lot of my home programs or my books focus on unilateral exercises. And that's because people need to understand that something is happening on one side of the body differently than the other. And in most cases, if we restore symmetry to length, range of motion, gait patterns, things like that, then usually pain will resolve, chronic pain will resolve. even after a replacement surgery. So it's usually not the surgery that is the problem. It's that we haven't restored proper function that led to the original breakdown in the first place. I'm going to take a moment here to please ask you to subscribe, like, and share this video with others who are dealing with post-surgical pain so that you can help them too. Thank you. So what are the primary issues? Well, I've talked about this in my other videos. For instance, this one about hip pain, this one about knee pain. So one of the problems leading up to the surgery is most people will go to their surgeon and the surgeon will say, you know, hey, you've got significant arthritis, you know, let's do a hip replacement. So when the pain gets to be too bad, then we'll have our hip replacement. Well, a lot of people will say, oh, well, when it gets too bad, and then they're going to say, well, I can take pain. So I'm going to go on for another 6 months or a year or 2 years or 5 years or whatever that is. I'm going to put up with that pain before I get that hip replacement. But what's happening is during that time, their body function is breaking down. They are creating more and more asymmetry in how they're using their bodies, which is then causing asymmetrical tightness and weakness in certain muscles that then causes the hip to break down or the knee to break down even more. But in their mind, they're saying, well, I can still put up with more pain. But what they don't realize, and what the surgeons aren't realizing, is that these bodies' function is breaking down. And so that not only does the hip need to be replaced, but the function needs to be replaced too. So this is, I think, one of the biggest problems that most people are facing when dealing with hip pain or knee pain after surgery, is that they've waited way too long to have the surgery and have created all sorts of other problems. Because asymmetry in the legs not only causes, breakdown, unilateral breakdown in the hip or the knee joint, it will cause responses in the spine, like a side bending problem, which I've talked about here, which can lead to sciatica, disc issues, all sorts of problems. But because they're talking to an orthopedic hip surgeon or orthopedic knee surgeon, that surgeon's focus is the hip joint or the knee joint, not how that plays out at your spine, your SI joint, your sciatic nerve, all sorts of things like that. And I'm not blaming them, because they need to be focused on being the best hip replacement surgeon that they can be, or the best knee replacement surgeon that they can be. I think what they're hoping for is that the physical therapist or chiropractor or whomever these people are going to prior to the surgery will point out the more systemic problems that are being caused by waiting so long for that hip replacement. So I believe that's one of the big things that's leading to a lot of the chronic pain after a hip replacement or a knee replacement surgery, is this significant breakdown in gait patterns, how you use that leg when you're bending over, strength problems, length problems, all sorts of accommodations that have occurred because of the system of problems that led to the breakdown in the hip or the knee in the first place. They've only become deeper and deeper the more people have waited. I hope that gives you some insight as to what might be going on with your hip or knee pain after your surgery, and maybe helps you rethink what you need to focus on after your surgery, rather than just simple hip or knee joint range of motion and strength. Maybe there is a larger functional problem going on here. For instance, a compensation from another leg, or problems deeper in the lower body system that were never addressed prior to the surgery that led to the initial breakdown in the first place.